Welcome back. More people are surviving cancer in the U.S. than ever before. A new report by the American Association for Cancer Research finds death rates from cancer in the U.S. have dropped 32% since 1991. In just the past 3 years, the number of cancer survivors has increased by more than 1 million just over the past few years. Let's bring in Dr. Ali Raja, Executive Vice Chair in the Department of Emergency Medicine at Massachusetts General Hospital. He's also a professor at Harvard Medical School. Good morning.
Morning, Christine.
So, Doc, what's driving the decline in cancer rates?
You know, Christine, it's actually two things, and they're both because of the fact that funding has really been strong for cancer over the past 4 decades, as you mentioned. The first is early detection rates. We have a lot of tests, and we've done a lot of screening exams on patients, everything from colonoscopies to mammograms and everything in between, to really detect cancer earlier, at which point it's easier to treat. And the second thing is new treatment modalities, so new chemotherapy agents, new kinds of radiation, the things that we can use to treat cancer, especially cancer detected early, have been really effective.
Are we living better? I mean, I wonder if that has anything to do with it. There must be fewer smokers today than there was in 1991.
You know, that's a good point as well. I think we are living better. It's arguable whether or not we're all doing enough exercise and eating well enough, but smoking is a huge difference between now and 1991. And you're right, and the rates of lung cancer detection and treatment reflect that.
President Biden recently relaunched this Cancer Moonshot initiative, and he has this goal of cutting cancer death rates by at least 50% in the next 25 years. Do you think that's a realistic goal?
Well, Christine, it really depends. And the fact is that a lot of this cancer early detection has been on the propagation of new screening modalities and sort of aggressive screening. That can work in patient populations that have easy access to health care and that we can schedule for their appropriate screening tests, like getting a colonoscopy when you hit the age of 45. But there's a lot of this country that doesn't have easy access to healthcare, whether that's because of inherent racial and ethnic biases or socioeconomic status, or the fact that a lot of folks just don't have primary care doctors. And so it's going to really depend on how well we can start screening. The treatment modalities are there, and we're going to keep working on that. But we really need to make sure that we can get everybody who needs screening for cancer screened early on to detect that early cancer.
Absolutely. Also this week, Doc, adults under the age of 65 should now be screened for anxiety. You know, that's a first of its kind recommendation from the U.S. Preventative Task Force. What does screening for anxiety entail, and how, in your view, can it help?
It's a fantastic and honestly overdue recommendation, Christine. Here's the thing. We screen for cancer. We screen for high blood pressure to try to prevent heart attacks and strokes. Screening for anxiety is just as important. It involves a simple questionnaire, usually done by a primary care physician. And the reason that we screen is that people can have anxiety and just not even know it, just like you can have high blood pressure and not even know it. And by answering those questions with a primary care physician, it actually allows people who don't even realize that they have anxiety to realize that they have it, to get treatment for it, to get therapy for it, to get on medications if they need it, and hopefully prevent something bad happening, just like we prevent heart attacks and strokes from high blood pressure.
Fascinating. All right, Dr. Ali Raja, thanks for dropping by this morning. Nice to see you.